Hey guys, Nurse Teresa coming back at you with another video on how to glorify God through nursing. I wanted to give you another video. Again, I am sitting in my living room. I'm relaxing. Just got home from a date with my husband. So I wanted to make this video about how to be successful in nursing. I know there's probably many videos out there, but I just want to give you my basic tips of what I feel like has helped me. I have not been perfect. I've made mistakes, as we all will, but again, remember that you are a human being and that mistakes will happen, but let's make sure that they are not detrimental or fatal to our patients, and let's jump right into it. So how to be successful in nursing, a positive attitude. I'm telling you, positive attitude is probably the most important thing you can possibly do, because I remember one patient, family member told me, your attitude can determine your altitude, because they loved how I was speaking to them and how I was treating their family member. So remember, regardless of where you may be in life or not be where you want to be, your positivity can change somebody's life around for the good, and you never know who's watching. The next one that I would say is don't be on an island by yourself, guys. Let's be team members. Let's realize that if somebody over there is drowning, let's go help them. If you feel like you're drowning, go ahead and find somebody to help you. Let's be a team. Let's not be on an island by ourselves. I heard that when I was in an interview. I think I had said it in another video. But again, it's extremely important, because a lot of the times, and I'm going to be very honest with you, if you don't get onto a team that is truly one unit and really trying to be there completely for the patient, because remember, it's not about how you feel about a coworker, it's about that patient. So again, let's all be on the same team. Next thing I would definitely say is be a patient advocate. Being a patient advocate, sometimes we learn about this in school, but it's real when you get to the real world of nursing. Always make sure you're doing what your patient needs, and also include some of their wants, as long as it's not going to be detrimental to their health. Always make your patient the number one realm in everything that you're doing, because they matter, okay? And also, don't just go based off of what a physician's order is. You have to have your own mind as well. Though you are following their order, you still have to make sure that it's in line with guidelines, that it's in line with policies and procedures. Let's not be automatic thinking. Let's not be, like robots. Let's actually use our minds. Let's make sure that the dosage is right, the frequency, the route, and everything else, and any contraindications. Another thing that I would definitely say about being successful in nursing is being eager for more information. Being eager for learning, being eager for life, being eager to better yourself and be as up to date as possible. Because sometimes, a lot of times, I will say, when you leave work, the job doesn't end. You still need to be able to be researching what is the latest technology, what's the latest data on whatever field or specialty that you're in. Really see, is this necessary versus is that necessary? Like, for example, when I was in nursing school, stop Max, I'm sorry, my dog. When I was in nursing school, we were putting in Foley catheters, and there came some scientific evidence that it wasn't necessary in order to blow up the catheter to hold it in place. It's a test beforehand, because it can make it flappy and it can damage the tubing. I mean, again, that was only because they were researching, they were staying up to date. So let's do that on our own as well. Let's not just wait until we see any new policies or procedures. Let's try and get the most up-to-date information as possible. Another thing I would definitely say is be conscientious. If you possibly can, be as detailed as you possibly can. It really pays off for you to be conscientious, especially with your patient, their environment, their orders. Sometimes patients can be on the same medications about 3 times. Let's be conscientious. Let's make sure we're very detail oriented. Another thing that I would definitely say is real-time documentation. Let's not wait until the shift is over or until you get on your break to use all that time in order to document. Let's go ahead and ask the patient. I don't care, even if you're a phone triage, like what I do sometimes now at my job. Well, what I do, as you're on the phone, document it. Yes, such and such, and that's going on. Okay, yes, I'm just documenting this. Everything. I don't care what specialty you are in. Try and document real-time documentation. That will get you ahead of the game, because you're not going to be sitting there over shift or an hour getting OT when you weren't approved to get OT just because you couldn't document. Let's do real-time documentation. Let's not be talking on our shifts. Let's not be sitting there lily-gaggling and, not doing what we're supposed to do. Be by your patient's side and do what you need to do so you can get out of there and get back to your families. Next thing I would definitely say is truly listen to your patients and your coworkers. Anything that's going on, personal, professional, really listen to them and see what information they can offer to you. Again, I'm very big on in the mornings when you come in and say good morning to somebody, and really listening to what they say and paying attention to how they respond, because sometimes the way somebody responds can be telling you exactly what they're going through. So let's do that. And another thing, again, is honest documentation. This goes ahead with real-time documentation. I think I said in the previous video, honest documentation. Sometimes I know I've heard of nurses going ahead and changing, tweaking things or something like that. You always hear stories like this, but let's not do that, guys. Let's give as much honesty, full documented information, as accurate as it happened, blow by blow, as much as you possibly can. But always be professional in your documentation. Don't put in there what somebody said versus what that one said, or what confrontation or how nasty that one was. That's not for the patient's chart. Let's be professional. And again, I make accidents. I make mistakes myself. I'm still learning myself. But let's make sure also that we're using approved abbreviations, medical abbreviations, in order to document. Don't sit there and put something crazy in chart that nobody else can read. Because just remember, think to yourself, every time you put in an abbreviation, remember to yourself, in 30 years from now, if I'm called to go to court, will I know this abbreviation? Last but not least, I think this is one of the most important things that I can definitely say, is integrity. Like I said before, hold your company up with integrity. Even if you're in transition, looking for a new position, or you're not exactly happy where you are, let's give our company the best we possibly can. Let's represent them in the right light. I'm sorry, my dog. Let's represent them in the right light. Let's hold them up to high standards, and let's give all of ourselves that we can, regardless if we're in transition to the next, or if we want to grow in the position we are. Let's give all of ourselves. And just like what Dave Ramsey did say tonight when I was listening to him, was I can only bump you up. You can only be bumped up to more greater things if you can be faithful in the little things. So let's go ahead and be faithful in the little things that do happen. Let's give praise to God for every day that we are given. And just know that I'm thinking about you. I love you and I'm praying for you. And whatever you may need, let me know. If you have any requests, let me know. Any advice, let me know. I am here. I love you all. And I pray the best and have a beautiful and blessed semester. All right, bye.